Hey guys, welcome to Herding Little Cows to the Glory of God. It's me and Elisha, and Naomi is behind the camera, but I'm going to talk about her. So, Naomi is having knee surgery tomorrow. So everyone who watches this, who would like to pray for her, her surgery is scheduled for about 11 o'clock tomorrow. We know how surgeries work. If they're going fast, they might get her in a little bit early. If they're going slow, they might get her in a little bit late. So you can pray for her. She can't eat after midnight tonight. She won't be able to have clear fluids after a quick drink in the morning when she gets up. So yeah, for those who want to know, Naomi hurt her knee multiple years ago. She's done it a couple times where she has dislocated her knee very, very badly. She did it again this year on Father's Day, and I gave her the option. She was 17 by that point, and I gave her the option. You let me know if you want me to call the doctor or not, because we've dealt with this before and it was getting better. So she's like, no, I think I'm okay. Well, then it was maybe, so it was Father's Day, so June. So maybe in July, I called to ask for an appointment because it just wasn't getting better. And they got us an appointment in September. So we went to the doctor and he suggested possible surgery, but we could try physical therapy first. When we went to that appointment, they did x-rays and they found out that Naomi has 2 bone chunks in her knee. One is a 1/2 inch long. I'm going to have her tell me if I just say something wrong. 1/2 inch long, and the other is 3/4 inch long. So the surgery tomorrow, they're going to go into her knee and they're going to go in arthroscopically. So just with tools in 2 little incisions here, and they're going to pull out those bone chunks. She also has cartilage damage in her knee. So they're going to fix, like take off some of the bumps and tears or whatever might be in there. That's harder to see. They did an MRI of her knee, but you still can't see all the damage that's in there. So they're going to clean up whatever they can. They're going to take a biopsy of the cartilage, and then they're going to send it off to a lab. Not because there's something wrong with the cartilage. They're going to send it to a lab, and then it can be regrown at a lab. So if in the next 5 years we decide to do something to, like if she needs more surgery, they can put her cartilage back in her knee. They won't be doing anything except taking out cartilage tomorrow. And then they also will be doing an incision and putting a new ligament from her kneecap to the bone to keep. This ligament on the inside is very, very loose. Daddy, Gideon might need your help. This ligament is very, very loose, and so they're going to put in a tighter pot. Daddy's coming to talk to you. See? Gideon wants a toy. And so putting that, and hopefully that's going to help. She will be immobilized for 6 weeks on crutches, but she will start physical therapy things shortly after surgery. But until they do the surgery, it's a complicated surgery they don't know until they get in there exactly what they're dealing with. So a lot of surgeries, you go in and it's kind of straightforward. Here's what we're going to do during this surgery. This surgery is more, we got to see what we're doing, and then we'll tell you what's going to happen afterwards, right? Is that a good way to explain it? So it is 7:20 here tonight. I'm going to get this up as soon as I can. So her surgery is on Tuesday, whatever tomorrow is, the 26th. Tuesday the 26th. So if you're seeing this after that, then she's already had surgery and look for an update video. But she needs to take a shower tonight with a special type of soap for the hospital has asked her to use. And then her and Daddy have to be at the hospital at 9:20 tomorrow to do their prep and all of that stuff. Mark will stay with her at the hospital because she is a minor. So he has to stay at the hospital just in case they have to make a decision during surgery or anything like that. But Naomi at 17, and our doctor agreed with this, Naomi is an adult in the idea that she can help make decisions for her own health care. So she decided that this surgery is in her best interest. Sorry, is your arm hurting? Making long videos. This surgery is in her best interest, and that makes me feel better as a mom because both her and I and everyone else in the family knows that there's going to be pain associated with the recovery of the surgery. And Naomi's good dealing with pain. Like I'm not worried about that aspect, but it's hard when you have a little one that it's hard to convince them that sometimes it hurts worse before it gets better. And Naomi knows and has made those decisions for herself. So that makes it better. Right, Naomi? Mm-hmm. So, Yeah, so she'll have surgery tomorrow. So if you want to leave her any well wishes or anything like that, you can leave them on this video. Mark will have his phone with him, and so he'll get all the updates if you guys write any messages tomorrow, and he can give them to her before she heads into surgery. But she'll probably be going to sleep around 10:45ish. So if you send messages before that, she'll get them. Or she'll get them when she comes out of recovery. And we'll try to give an update tomorrow night. So thank you for joining us on Herding Little Cows to the Glory of God. We'll see you next time. Say bye. Oh.